Hi, welcome to Detours Understanding Acquired Brain Injury. And today we're going to be starting essentials of pediatric acquired brain injury. Obviously, kids suffer acquired brain injury just like adults do. But the thing about this series, when we're talking about kids and acquired brain injury, is that we need to remember, and I'm going to be saying this throughout the series, is that kids are not just little adults. And this is something that a lot of docs remind people about too, that children have a number of differences between adults anatomically and physiologically, both on the larger scale and on the microscopic scale, which affects how brain injury affects them. And the other thing to keep in mind is since kids are just beginning to develop, regardless of what age they are, a brain injury affects them in some very drastic ways as far as their long term future is concerned because they have so many years still ahead of them. And so it's important to understand some of these things. So let's get into, first of all, basic numbers, some epidemiology. 1 in 500 kids, 1 in 500 will suffer some kind of acquired brain injury during childhood. Now, we know the numbers are much higher for adults, but this is those who will experience a brain injury at some point during those developmental years. And this is important. We'll get into why a little later. But yeah, 1 in 500. Most of them, of course, tend to be mild traumatic brain injuries, but there are those who suffer, obviously, moderate or severe acquired brain injuries, too. So, okay. Secondly, there are two peaks of acquired brain injury, specifically since we'll be focusing on traumatic brain injury in these first few episodes before we get into pediatric infectious diseases and pediatric cancer, brain cancer, and metabolic problems, things like that. We'll be focusing on pediatric TBI just like we did with the Essential series for adults. So, two peaks for traumatic brain injury. The first peak occurs when they're about ages 14 through 18. This shouldn't really be a surprise, and this is the bigger peak because the most common cause in that 14 through 18 is motor vehicle accidents. Number one cause. Also, falls, like adults, where falls are number one, kids' falls after MVAs come next. Because, it's like falls from all kinds of different places. Most people think standing to ground. And while that does happen with kids, more likely it's from some degree of height. Kids are starting their first jobs when they're like 15, 16, 17, 18. So if they're helping out, on the roof, or if they're doing any kind of if they're it's like for some sports, they'll fall from a height potentially, or if they're doing some kind of activity, they're at risk from falling from height. If, at school, they're doing things like an egg drop or whatever, if they're doing from the roof or whatever, falls from height. And so it's important to understand that, that puts them at risk. So falls next. And yes, when 14, 13, falls from your bicycle or like a tree house or, whatever, projects, things like that. Also like hiking or, okay. After that, you'll see some like bicycle or pedestrian or sporting accidents. So that's common too, as a source of injury for the 14 to 18-year-old group. And also, assaults. Unfortunately, that number is going up too, and just watch the news and you'll see that that's a problem. All right, the second peak happens from 0 to 4. For the older ones of the 3, 4, getting towards preschool age, 4, 5, usually it's pedestrian versus motor vehicle. or learning their bicycle, or some kind of outdoor activities. Um, and in some ways, there's some overlap with some of the older kids because sports do play a role. Athletic activities to school age, and you do see like pee wee football, like the 5, 6 year olds. So you'll see some athletic overlap, and this is something you do see with the older kids too. But that's almost a separate kind of thing within um, this grouping here. And you'll see that into school age as well. So that's more or less across the spectrum, athletic activities from as soon as they're able. So it's important to keep in mind that that's almost a separate kind of, because that's continuous. From 0 to 2, leading cause of brain injury in kids, specifically traumatic brain injury, is abusive head trauma. Almost 45%. Shaken baby, we're used to calling it that, but abusive head trauma implies more than just that. That includes things like choking, that includes things like smacking a kid against the wall, trying to suffocate them, things like that. So any kind of a deliberate, intentional head injury, brain injury, because it's more than just head injury. It's any kind of maltreatment with intent to cause harm. That. And we will be talking about how to identify that, and on our separate category for physicians, we'll also be talking about ways for doctors, nurses, and therapists to identify the specific characteristics of abusive head trauma. Doctors, nurses, psychologists, clergy, teachers, almost everyone is now a mandated reporter. If you think there's abusive head injury, abusive head trauma, you must report it. It is the law. It is in every state now. You have to report this to law enforcement, to children and youth, whoever the organization is in your state. That's mandatory. In most countries, likewise, you have to report it. Whether you're licensed, certified, whatever, you must report it. And then there are permissive reporters, who's almost everybody else, who are encouraged but not by law. So be aware, and check the regulations for whatever it is you do. Like if you're a cosmetologist, or if you're, if you do nails, or if you do like whatever, if you walk dogs for a living or whatever, you might think, well, gee, what do I have to do with? In many states, they are mandatory reporters, so it isn't just the ones you would think. So, it's like, know what the law is for that. All right, we will be talking about that later, separate and specifically. All right, so something else important to keep in mind, like school-age kids kind of overlap between those two groups, and so it's usually like pedestrian versus car, or motor vehicle accidents, falls, sometimes assault, and playing outside with their bicycles, versus car, and sports again. Okay. Lastly, and also important, I think, to address when it comes to pediatric, specifically TBI, although this applies across the board. There's no standardized treatment for kids acquired brain injury. There's some docs say this, some docs say that, some docs say that, because the research already is poor when it comes to treating adults. The research is equivocal for a lot of things. We do have some standards and say do this when they come into the ED, the ICU, the OR, etc., etc. But we do have some things that are consistent. When it comes to kids, that's even less so. So there are general concepts, but again, research. So it's like going to a big trauma center is most helpful because at least there is some consistency, but you've got to deal with what you have. So it is wise for you as a parent or as a caretaker to say, okay, it's like keep an eye on things, ask questions, try to figure out what, what's going on, what's doing, and to, be aware of the kinds of treatments. And if you think something isn't right, speak up. You are the advocate for your child, advocating all the time. That is important, All right, so let's talk about some of the anatomical and physiological differences between adults versus kids. One of the things to keep in mind is that in kids, their skull is still developing. And their head, relative to the rest of their body, especially young kids, infants, toddlers, relative to the older child and adolescent, the skull is much larger relative to their smaller body. And so they're kind of top heavy, and they'll kind of, to trip over. And their neck muscles, the neck muscles are weaker. And so a large head on top of relatively smaller body relative to tends to topple over towards the front, and they'll tend to fall right into the front of their head, and the brain gets shaken around much more readily, which is why injuries like that, plus their neck muscles are weaker that support where the skull sits. And so that also causes complications. And they're more likely then to risk also their developing spine. And so as a result of that, they also can have spinal injury at a younger age. And it doesn't take as much force because as their bones are still developing, there's a lot more cartilaginous tissue, a lot more cartilage, and it hasn't solidified to bone everywhere yet. Again, especially the very young infants and toddlers, where things are still growing and developing. The fontanelle, up front for most of us, where we have the frontal bone, it seems hardened as in solid, but in infants, there is typically and you could feel it in yourself. It feels like there's a divide in your skull there, and that's because it's made of separate plates, the frontal, and you can even see the divides in the bones where the plates fuse together over time. But in infants, these bones are separate, and one of the things that in the emergency department they may do before these harden is be able to visualize the brain using ultrasound. But the fontanelles may bulge or swell if there's an increase in pressure. It's not unusual to swell a little bit, but if you notice that kind of swelling after an injury, that's kind of a red flag that, hey, they need care. You may see this when they're sick or other things. Again, if they're having problems draining fluid, we've talked about hydrocephalus before, there may be an issue at hand. So those bones have not hardened when you're dealing with an infant yet. So, keep an eye. Also, children and adolescents have high metabolism, as if you didn't know. They have energy to go and run everywhere. Now, this might seem a good thing, but what it also means is their brains need a constant supply of oxygen and nutrients. And so if they suffer traumatic brain injury or any form of brain injury, actually, their cells are more vulnerable to self-destruction, neurons and the supporting cells, because if they are starved of even a small amount of the nutrients and the oxygen that they need for even less time than with an adult, their cells are more prone to destruction and to that inflammatory process we've talked about so much. So keep in mind that because their neurons are still growing, developing, are still making new connections, and are still myelinating, get to that in a moment, their metabolic demands are higher, and therefore apoptosis and neurodestructive cascade is much more probable in kids, are more vulnerable to this. And this is one of the things where, depending on the age of the child, brain injury can be much worse and have much longer lasting and lifetime potentially consequences. So it's important to understand this difference. Also, white matter. The neurons, when we talk about gray matter on the surface and the white matter bundles that connect in kids' brains, Those deep areas that link the different regions to network them together are not finished myelinating. It's why kids sometimes, I've made this joke about, gee, kids are like brain injured adults because those regions are not yet myelinated or not connected. Their parents act like their frontal lobes and act like those, like the parietal lobes for academic skills and things like that, because those links are still being made. If they suffer during one of these critical sensitive periods, an acquired brain injury, it can end up preventing them from making those necessary connections at all. And so they may look okay, they may look fine during those ages when they are like their peers and need other people to stand in for those systems in their brain. But as they get older, when their peers mature, when their brains are finally finished myelinating, and this takes a long time, especially for those prefrontal cortical regions. We talked about them, the orbitofrontal cortex, dorsolateral aspects, medial, which help you with social skills and executive functions and high order skills, the abstract thinking, cognitive flexibility, those kind of things. Those take into your 20s typically to develop, and even early 30s for males and late 20s for females before they're fully developed. So you may not notice a child's brain injury for 2, early 3 decades, depending on where it is. And because of the way of shape of the inside of the skull, we've talked about this too, where there are sharp edges like sphenoid wings in here. These act like a cheese grater and grind those areas of the brain in the frontal lobe. And this is part of the reason why traumatic brain injury seems to cause so many of those behavioral and psychiatric deficits, because those areas of the frontal lobe are what are damaged, as well as the shaking and what leads to the diffuse axonal injury. And because kids' brains aren't myelinated yet, and the expectations aren't there yet that they act like little adults, that they act like the adults they will become, parents are like, oh, he, she, Billy, Susie, whatever, is, well, they're just a little kid, but as time goes on, they would seem different from their peers. They're not learning to work together well. They're still like irritable and angry about everything. They'll act like they're 3, 4, 5. They'll start to show what look like personality disorders, or they'll start to show problems with more advanced thinking, specific learning disability type symptoms, problems with planning, problems with judgment. They may ride off in a car with a stranger, drinking, drug abuse, violent behaviors from a brain injury they received when they were 5. Maybe they, fell off a high chair, or fell off a counter, or maybe, they were ice skating. I don't know, and they took a really hard blow to the head. But because their parents were playing the role of frontal lobe, and were bigger than they were, and were there with them frequently, just like the other kids, nobody noticed that there was this deficit that was developing until suddenly they had to start acting more and more like adults, and they couldn't do it. And that deficit has always been there, but it wasn't noticed. This is one of the problems it can cause. Now, earlier on, you may also notice that they have academic problems, because these areas of the brain back here in the parietal lobe towards the back, here are associated with reading, writing, mathematics, symbolic reasoning. Those areas are expected to develop more quickly, and they generally do, and they have spatial function, things like that, judgment at distance and orientation space, as well as, again, symbolic meaning. The letter A means or or A, and when reading, things like that. And so these kids may stand out if they have broad diffuse axonal injury. Okay, something isn't right here. But many parents, it's referred to as occult brain injury, hidden brain injury. So we'll get much more in depth, as far as specific disabilities and disorders as we get deeper into this, because a lot of kids are diagnosed with ADD, ADHD, oppositional defiant disorder, reading, math, or writing disabilities, and all these other things. What they're seeing is a brain injury from earlier on. And pediatric traumatic brain injury, acquired brain injury, is a diagnosed disability by law for special education, and it is separate from ADD, ADHD, and behavioral disorders and things like that. And as these kids develop, they're at risk of developing some rather severe psychiatric problems too. And that is something else important to keep in mind. Also, at that age, the brain is a lot more watery. Most of an adult brain is about 60%, 70% fat, which is from the myelin, the white matter, and the cells that help bind and provide for energy, things like that. Kids' brains a lot more watery. So you can imagine that more likely to have problems with edema, brain swelling, fluid shifts, and osmosis as water follows salt. And so certain kinds of both traumatic injuries as well as infections and metabolic disorders are more likely to do damage as well. This changes fairly quickly. This is more, again, a problem that you see like in childhood into early adolescence. But still, there are those changes that occur. It also affects how the mechanics of the brain as it's shifted around inside the skull. For, again, this kind of traumatic brain injury, the mechanics of it. For kids, it's different. It's important to keep in mind. And increases the chances of bleeding, too. So hemorrhaging inside the skull as well. Microcirculation is still developing. The blood vessels that feed the neurons, that's not complete yet. And so you're more likely to get tears, ruptures, things like that. It's important to keep that in mind as well. Less developed immune system. As you know, like kids pick up, like everything that comes through, and they develop high fevers quite often. That is a risk to set off the immune system, and the immune system of a kid is more likely just to scream attack for everything, because it doesn't have the ability to modulate up and down as well as older adults do. So this is more of a threat for like the school age kid or the preschool toddlers, but very dangerous. And it also can lead to like all kinds of infections, meningitis, other things like that. And this is why they want the shots for kids going to school and all the vaccines. These kind of even a relatively minor infection for an adult can kill a child. And one of the ways this happens is by going after the brain, because the immune system just isn't developed enough. And so one of its solutions is to crank up a high temperature. And we talked about brain injury from high fevers, high temperatures. This is one of them. And that's another problem kids have, their thermal regulation. They don't handle heat too well. Or cold for that matter. Again, they're still developing. And all these regulatory systems just aren't in place yet. And so they're more vulnerable in that way as well. Blood-brain barrier is not completely developed. It's still, becoming more. And so you get proteins that shouldn't be in there. You get immune cells crossing the blood-brain barrier much more easily. So again, you get problems with apoptosis, inflammatory markers, cytokines, all this good stuff. And again, when a child suffers any kind of insult to their brain, it's more likely to have this secondary cascade, which is why trying to treat it is so important, and why taking a kid who's showing signs of meningitis, encephalitis is just so critical. They're much more likely when they're young to suffer severe illness. pruning and dendritic spikes, that's still developing too. Teens, adolescents, their brains are going through a process called pruning, where there's a saying in neurology: neurons that fire together wire together. And so excess neurons are kind of pruned back. The connections are cut back so the brain's more efficient and works better. This is why they seem to get smarter as they get older. It's like, oh, they're starting to use good judgment. This is because of this change. But when you're younger, everything is still developing. And this is one of those vulnerable ages. In your kind of late teens, early 20s, it's a very vulnerable time when your brain prunes back, because if you suffer any kind of acquired brain injury during this time, like I said, late teens, early 20s, it may alter how your brain prunes back and how it makes those connections. It may just, again, magnify the secondary cascade significantly. And that's really a lot of what we're talking about here, how these secondary injuries are worse, these critical periods. And the brain is still myelinating itself. So multiple vulnerabilities. We don't understand how the sex hormones affect. We do know that some of them tend to be a bit toxic, but mildly so. It's only if coupled with brain injury, but we don't know how these changing levels of testosterone, estrogen, and yes, both male and female have progesterone, testosterone, estrogen, both of them, male and female. We don't know how these changing levels interact with the developing brain. Not to mention all the other hormones interact with a developing brain after, a brain injury. Does it make it better? Worse? No idea. Kids have lower blood volume. They're more likely to bleed out in shock and go into cardiac arrest. They have 2/3 of the blood volume when they're, like child age, adolescent, getting into early adolescence. When they're babies, it's like a small amount of blood loss can be sufficient to drive them to cardiac arrest. Which is, and with problems with autoregulation, blood pressure, things like that. So, and one of the things about kids is they look like they're doing okay, going along, unlike an adult who slides down the shock, slides down the slope for shock. Kids will go along, and then just drop off. So it looks like they're doing fine, and then suddenly they'll crash. They'll lose regulation, whereas an adult will slowly go down the slope, and you recognize there's a problem. Kids will look all right, and then suddenly crash, which is why you've got to be proactive with an injured kid. And this is why medical intervention is important, because it's hard to recognize those signs just by eyeballing them. We will talk more later about recognizing what you're looking for in kids. Okay. Their chest is less protected. So a blow to the chest can trigger cardiac arrest, can trigger respiratory problems. That's something to keep in mind. If a kid is getting shocky or whatever else, usually it's a respiratory problem. It's not cardiac. Most kids don't have primary cardiac problems. Most. There are some exceptions, of course. Most kids, when they get into trouble outside, it's respiratory. It's a breathing problem in most kids. And with their weakened immune response, it's like something they caught, asthma. And while boys are more likely to have asthma, it's more likely to go away. Whereas if girls develop asthma, it's more likely to persist over their lifetime. So it's important to keep these kind of things in mind, because asthma can also lead to respiratory arrest, hypoxia, and brain injury. Important to keep that one in mind. So it needs to be taken care of, just like problems with blood sugar, hypoglycemia too. Smaller lungs, smaller volume, higher chance of pneumothorax. Talk about that later too. And their abdominal organs are relatively larger relative to, again, the body size. So something to keep in mind. If you do some damage there, again, that's another place for a hidden bleeding. Again, this is something that I would expect physicians would know, but something to keep in mind. Uh, spleen, bleeding into the spleen or into the abdominal space, ultrasound. Also in perirenal space around the kidneys, hidden places for bleeders. Always want to check that. And of course around the heart, although that's easier to find, but bleeding into the spleen, things like that, that often leads to pediatric cardiac arrest. And it's very hard to identify that right away because it's fairly silent, again, until they... So, always check that one out with ultrasound. Make sure there's no blood in that space or around the kidneys like that. Just throwing that in there as a bonus. Again, it's like... All right, so we touched on the major differences for adults and kids anatomically, physiologically, and so then we'll be getting into like causes and other things in the next episode. Just some things to keep in mind. If you have any doubts ever, it's better to go to the emergency department, call 911. Don't take them yourself if you really think it's critical. You don't have the equipment, and unless you're a top-notch surgeon or emergency doc or an emergency medical professional of some sort, it's not worth taking the risks. Call 911. The paramedics have the equipment, communications. They can get a helicopter if necessary. And most of all, they have the expertise and training. All right. Please remember, this isn't a doctor's office. This is meant for supportive education. If you have any questions, please call your doctor. Just speak to them. If you have concerns, call a rehab physician, speak to the medical professionals for information. And please, we hope you found this helpful. Share this information with anyone who might find this helpful. This is an area that still we're learning about. Brain injury in kids, still a lot of areas that are not well understood, not well known. Hope you come back for our subsequent episodes. If you have any questions, comments, please leave them below. Click like and subscribe. And again, share. Have a good day. Bye.